Okay, so let's talk about the second part of the chapter 8 for autonomic nervous system. We were on anticholinergics. So anticholinergics are mainly used to dry the excess secretions and to treat the asthma. So let's say cholinergic effect is showing by something in our body. So we need to stop that action. We need anticholinergics. We need opposites of that. What are the cholinergic effects, if I remind you? If you remember, cholinergic effects, they are parasympathetic, and parasympathetic were on the left side of that chart that we discussed in the first 2-3 slides. That will increase the salivation. That will constrict your pupil. So let's say a person is coming to you and he complains about his slow heartbeat or increased salivation. So we will give them anticholinergics. So they are the mainly used to dry the excess secretions and to treat the asthma or the lungs as well. Anticholinergic drug actions, as I am telling you, they opposite of the parasympathetic nervous system. They mimic the fight or flight response and they block the muscarinic receptors so that they can show their action. Therapeutic uses will be opposite of that because before they were constricting the pupil, now they will dilate the pupil. They were decreasing the heart rate, now they are anti, so they will increase the heart rate. There were excess secretions, now there will be drying of secretions. There were the constriction of the bronchioles, now they'll do the dilation of the bronchioles. Adverse effects that limit their usefulness, sometimes they call it tachycardia. Tachycardia means fast heart rate. Heartbeat is fast. That is called as tachycardia. Urinary retention in the men with the prostate disorder. So those persons who have tachycardia from any other drug or any other disease, who have a urinary retention problem, who have a prostate disorders, we are not supposed to give them anticholinergics then. Now, in other classes, the drugs for disorders associated with the autonomic nervous system, we have alpha-1 and beta-1 agonists, which are used as alpha and beta both. They're pseudoephedrine, they're dopamine. You don't have to remember their brand names for now, just their generic names. You need to remember generic names. There might be some questions asking you, dopamine belongs to which classification? So dopamine is a alpha-1 beta-1 agonist. Alpha-1 agonist is phenylephrine. Alpha-1 blocker is doxazosin, all the sins, azosin, prazosin, terazosin. Alpha-2 agonist is clonidine, only one drug. Anticholinergics, these are the atropine, oxybutynin, and tolterodine. Ipratropium bromide, solifensin. Beta-1 blocker, non-selective. They're not selectively blocking something. That is propranolol. This is a very, very common drug used. We need to remember the brand name for the propranolol is important. Ipratropium is important. It's Atrovent. Then we have beta-1, beta-2 agonist, isoproterenol. Beta-1 blockers with alpha-1 blocking agents, labetalol, very important drug. Beta-1 blocker, it's non-selective again, it's lols. Timolol, pindolol, nadolol. Beta-1 blockers, selective, atenolol and bisoprolol. Metoprolol, nebivolol, acetobutyol. Beta-2 agonists are the salbutamol, it's Ventolin, terbutaline, it's Bricanyl. Beta-2 agonist long-acting is salmeterol, formoterol. Beta-3 agonist is the mirabegron and pilocarpine. Sympathomimetics, they're primarily used for their effects on the heart, bronchial tree, that is in the lungs, and the nasal passages. Sympathomimetics are the drugs who produces the same effects as the sympathetic drugs or anticholinergics. They stimulate the alpha receptors and the beta receptors. Their actions are more specific and their use are wider than the others. They affect alpha and beta receptors, so it means they're affecting heart, they're affecting the lungs, that is bronchial tree, and the nasal passages as well. There are some selective sympathomimetics. Selective sympatho means they stimulate certain selective things, certain adrenergic subreceptors like alpha-1 receptors. They are located in the nasal passages. They dry the nasal secretions. Beta-1 receptors, especially, they dry the nasal secretions. They are located in the heart. They increase the heart rate over there. They increase the force of contraction, especially, again, the beta-2 receptors. They are located in the bronchi and they does the bronchodilation, means they dilate the bronchioles. Next are the non-selective. So if it's non-selective, they are not selecting anything. They are affecting all adrenergic receptors. Epinephrine is one of them, and they're used in cardiac arrest and asthma. They are alpha-1, beta-2 receptors. For example, pseudoephedrine is a drug, which is alpha-1 and beta-2. It is used as oral nasal decongestant drug. Beta-1, beta-2 receptor, if you remember in the chart, we did the names of these drugs. Isoproterenol is used as a beta-1 and beta-2. It increases the rate, force, and conduction speed of the heart. There are more autonomic related side effects. Next, adrenergic blockers are primarily used to treat the hypertension, that is high blood pressure, and are most widely described or prescribed class of the autonomic drugs. They inhibit the sympathetic nervous system. They produce the same response as parasympathomimetics. They're most widely used class of autonomic drugs, and they're used to treat the hypertension. These are adrenergic blockers. Again, I will remind you, adrenergic, they act on the sympathetic nervous system, especially at the fight or flight response. They are blockers, they are inhibiting the system. It includes alpha-1 blockers. They relax the vascular smooth muscles. They causes the dilation of the blood vessels. They decrease the blood pressure in the body. They treat the high blood pressure. For example, is the doxazosin. Any azosins, doxazosin, trazocin, prazosin. These are the three drugs under that. Beta-1 blockers. Beta-1 receptors, they're found only in heart. Again, please remember, they're only present in heart. So they slow the heart rate and they lower the blood pressure. Cardioselective, for example, atenolol, that the brand name is Tenormin. Some beta blockers, they're non-selective, block both beta-1 and beta-2 receptors. They're used to treat hypertension, angina, cardiac arrhythmias. Propranolol, for example, Enderel. It's a very, very important drug, propranolol. Apart from the hypertension, angina, cardiac arrhythmias, nowadays it is also used for the migraine prophylaxis. More adverse effects. So summary of this chapter is, in nutshell, again revise, the nervous system has two parts, central and peripheral. Autonomic nervous system is a part of peripheral nervous system, and it has sympathetic and parasympathetic branches. Drug actions occur at synapses, and they involve neurotransmitters. And the common autonomic neurotransmitters, we did acetylcholine and norepinephrine. If you remember, acetylcholine is for the parasympathetic and sympathetic at the preganglionic, and the norepinephrine is only at the time of the stress for the sympathetic nervous system at the postganglionic. Autonomic drugs are classified by which the system they block or engage. Now, cholinergic medications, they have many side effects. Consequently, they have only few therapeutic uses. Anticholinergic drugs, they're used to dry all the secretions and to treat the asthma. Sympathomimetics are used for their effects on the heart, bronchi, and the nasal passages. Adrenergic blocker, most widely prescribed, are primarily used to treat the hypertension. This finishes with your chapter. It's a little lengthy chapter, but if you try to understand, it's easy to understand. For getting more understanding, I would again remind you that you have to read the book. Without reading the book, you won't be able to understand completely. The pictures given in this chapter, the tables given in this chapter, please go with them and take the help of those. They will be very, very helpful. Still you get any questions? Get back to me. Thank you.